Well, welcome to everyone who's here for this interview. This is Barbara Sattler. She's an international expert on environment, and she's a nurse, and she works as a professor. And I'm very honored to have her as part of this telesummit as we sort of look into the future and see what we're in store for us. And one of the things that she want to quote, I wanted to start off with the quote that she sent me from Buckminster Fuller. It was about we can create the future if we design it. So I'm very excited about listening to your vision of what the future brings.
Well, thank you. I'm delighted to be here. And I'm also excited to hear some of the other nurses and how they're planning on helping us develop the future.
Yes, yes. So it's been the most exciting telesummit for me because I'm meeting incredible visionaries, and everybody comes out from a different perspective, and everybody's perspective is creating the whole. And to celebrate, this next decade, and Florence Nightingale was a visionary for nursing. I think that what we're creating right now is the vision for nursing as collective voices. So I wanted you to share about what you know and what you feel and from based on your life experience, what you see how we can step into the future and create it.
Sure. Well, thank you for this opportunity. So what I have looked at over the course of my life is really how both individual humans, but populations, how we are differently affected by our environment. And by that, I mean literally our air and water and food and what's on our food and the products that we have. And over this span of my career, that's taken me from the things that everybody does know a little bit about, like lead poisoning in children, but then also looking at the products that probably you use today and many of the nurses will use today that have known toxic chemicals in them, and that we have actually allowed legally for companies to put toxic chemicals in our products. So I've done a lot of work with nurses on really looking at what is going on with our chemical policies and how have they happened. And this is a world that most nurses don't go into. It's dealing with agencies most nurses know nothing about. For instance, the U.S. Environmental Protection Agency.
Right.
And the U.S. Department of Agriculture. And yet what we know is mostly what nurses learn in school is how to take care of people when they're sick.
Right.
We don't spend a lot of time thinking about what's making them sick. And more lately, we've been really talking about the social determinants of health. And that's really important to learn about, but we have to do something as nurses about these social determinants. And that means building a stable of skills and knowledge that is kind of out of our comfort zone right now for many nurses. And one of the reasons for that is a lot of nurses never learned that. Nurse faculty didn't learn that in nursing school.
Right.
We didn't learn about environmental health in nursing school. So they lack some of the content, they lack some of the confidence to bring it in. And so it's still absent in our curriculum. So my vision is that we really begin to build that capacity. And one of the places that we're seeing this is on climate change.
Yes.
So climate change is something, while I can talk about the chemicals in our food, air, water, et cetera, I think that that's not the above the fold news every day. Climate change is there pretty regularly.
Right.
So we can use that as a way to begin to generate excitement in nurses to not just wring our hands and say, oh my goodness, I'm reading about this, it's really depressing me, I don't know what to do. Well, we can help develop what we can do as nurses. And there are really a lot of different things that we can do. But once again, it may mean stepping a little bit out of our comfort zone once again, because we haven't learned this, we don't have the knowledge and skills. So it's going to be really, sort of moving our horizons out. But I think what ultimately it's going to help us do is actually help people healthier, which is what nurses are all about. And, you know, I live in Northern California. I live in Sonoma County. We have had fires now a couple of times, big ones near where I live. And we know that extreme heat prolonged heat is something that we're experiencing everywhere in the country. You're in Florida, so
Yeah.
you already have prolonged heat. But in Northern California, we don't have air conditioning. Homes don't have air conditioning. And many parts of the country where they're now experiencing extreme heat don't have air conditioning. So I've gone on and on. But I think that what we need to begin to do is really help nurses understand that they can play a beautiful leadership role in this because we're so trusted, and that we need to gain some skills and knowledge in order to really evoke that leadership.
Can you tell me about some of those skills that we need to learn? Because I'm personally very interested in environmental health, and I've been, you know, as an environmentalist, I'm very interested in how we can protect the environment as a public health issue. Tell me some of the skills that you think that we need to develop.
Mm-hmm. Sure. Well, one of the things that I know is often taught in nursing school is policy.
Right.
But I don't know a lot of nursing faculty that ever go to their state capital other than maybe the once a year when it's the nurses lobby day.
Right.
And yet that's where the sausage is made. You know, that's where it's not always pretty, and we're up against what I call the suits. I brought nurses to a policy, to a hearing for them to do presentations on the use of non-therapeutic antibiotics in animals.
Wow.
When we raise animals, hogs and cows and beef cattle, they're sometimes given antibiotics that are not therapeutic. It's not because they have an infection. Anyway, so I brought these nurses and we sat up in the front row. Right. And this was at the state capitol in Maryland, and they were preparing to give testimony, and in fact gave testimony. And all the people behind them were people in suits who were from the pharmaceutical industry.
Right.
And so what they understood is here's health, because the more we use non-therapeutic antibiotics, the more risk there are for the development of these superbugs and,
right, of course,
antibiotic resistant organisms, which we are seeing more of. And then here's this huge capacity of the industry against the nursing and public health voice. So this both was intimidating as well as, to some of them, inspiring, like, we have to be here. We can't not be here. And so that's where I want nurses to get to, and nursing faculty, is we can't just go on lobby day once a year. Exactly. That if there is a health issue that we're really interested in, we need to figure out where those policies are going to be made. Is it at a regulatory level? Is it in our state capital? And what they also discover, we've brought a lot of nurses to Washington, the Alliance of Nurses for Healthy Environments, a national organization I helped create. And we were invited by Obama to go to the White House and talk about, so we brought a bunch of nursing leaders to the White House to talk about nurses' roles in climate change. And what people begin to understand is that these are just other people, you know. And the president, well, this one is just another person. Our senators are just other people, and you know, Congress people, as well as our state policymakers, and that we come with enough knowledge as nurses, with just a little bit more content to be able to speak, I think, both from our hearts and our minds around these issues, and we're listened to.
So tell me about this organization, the Alliance of the, and is this where somebody could go to get the resources they need to be able to speak to their congressman? Can you tell me more about that organization?
Sure. It's called the Alliance of Nurses for Healthy Environments. We're now 12 years old, so we're relatively new, but it was an organization that was created by 50 nurse leaders from around the country who realized just what I said earlier, that environmental health isn't being integrated into nursing education, into our practice, so we're missing opportunities
Right.
for diagnosis, for anticipatory guidance. We weren't really researching it very much, and we weren't doing that much policy and advocacy. And those who were far and few between around the country. So we pulled together this alliance in order to better coordinate the nurse leadership that existed on environmental health, as well as inspire others. And so we are a membership organization, but all you have to do is say, I'm in. There's no dues.
That's
So
great.
you can join us. We have a virtual textbook that we've created on our website.
Right.
Once again, it's the Alliance of Nurses for Healthy Environments. We have about a dozen national nursing organizations plus Sigma International, part of our climate change consortium. So we help to coordinate other national nursing organizations to address climate change. We also have been working on issues that don't seem like, on the face of it, we might work on, but we've worked a lot on fracking around the country.
Wonderful.
Many nurses are living in communities where fracking is ravaging both the land and ecology, but as well as the human health in the area. So we work on these issues that, once again, sometimes new nurses will kind of scratch their head going, well, why is a nurse in that domain? Well, it's health. It's about health. Yeah.
So I think your gift should be an invitation so everyone joins this alliance. So that way everybody knows how to get the link and join so they can be part of this, because this inspires me, because I'm an environmentalist and I am a nurse, and I didn't really relate. I related it in my heart that I was a nurse, and this was an important to me as a nurse to be an advocate of protecting the environment for the public health of human beings. But I never really knew there was something going on in the profession of nursing. So this is really exciting.
Yeah. Well, we welcome you. Obviously, we welcome you and anybody else who's going to be listening to this.
Yes. So one of the things you talked about was there's a couple of issues. One was the chemicals and the toxins and things that are in the home, and how we can become aware of what those toxins are. Is there a resource that you've created through your alliance, or you would recommend for people to know about what those toxic products are?
Yes. So there are two things that I have my students and anybody who will listen to me go to first.
Okay.
So one is, if you just Google Safe Cosmetics Database,
okay,
you go to a database that's really user-friendly, and you can put in your precise deodorant, hair product, face product, and it is going to tell you whether there are neurotoxicants, carcinogens, reproductive toxicants in your product. It will also give you a sort of rating, so you'll know where it rates relative to other products. So that's one. Then the other thing that I send students to is it's a website. They also have an app called What's on My Food. Now, don't go to What's in My Food. That's by Campbell's Soup. But What's on my
food. Okay.
And you can put in, like, give me an example of a fruit or vegetable you ate yesterday.
A tomato.
Okay, you can go in, put in tomato, and it's going to tell you, based on the US Department of Agriculture numbers, what are the likely pesticide residues that were on that tomato, unless you ate an organic tomato. So this will give you not just a sense of those chemicals, because most of us look at those chemical names and go, oh, this is not helpful. It will tell you whether, once again, it's a potential carcinogen, reproductive toxicant, neurotoxicant, or if that particular chemical is toxic to bees.
Wow, that's big.
Right.
I'm a beekeeper.
Oh, wonderful. Yeah. Me too.
I love it. I love it.
Oh, lovely. That's really terrific. So sisters in bees here.
Yes. That's fantastic. So it's what's on your food.
What's on my food.
What's on my food.
My food. So those are two places. And the reasons that I send people there first is so that you understand this is not about, you know, a poor social justice community over there that has all of these chemical exposures. This is about all of us. And it's an indication of our failed chemical policies, that all of these harmful chemicals are in our everyday foods and everyday products.
Right. Is there a field in nursing that you know of that's evolving that teaches about what I would see in the future is that there would be graduate programs where nurses would become activists, active and educated, informed, with negotiations, being able to work at a lobby level, where we would have a role in our society to become advocates for public health and the environment and this kind of thing. Do you see that there's anything evolving in the educational program today that will morph into that in the future?
So I think that we're seeing more population-based DNP programs.
Okay.
And so those are programs that are at various levels of success, I would say, but
right.
Trying to evolve from looking at how nurses interact and work with individual patients to how we look at keeping populations healthy.
Right.
So populations-based health. The public health nursing faculty are definitely have and will always be, but we're seeing less and less of them. And there are some nursing programs that don't have community public health at all anymore to any real effect. So this is one where the public health nursing community is kind of aging.
Right.
And the nurses who have been faculty have been more hospital-based, critical care-based. So when we have a nurse that is inspiring about population-based health, students get that. And they begin to then think about alternative pathways for themselves. And our students work in a variety of settings. So some of the students that came out of the environmental health program that I directed at the University of Maryland for many years, they went on to be directors of sustainability for their hospitals.
Right.
They went on to leadership positions in nonprofit organizations. Some of them stayed in hospitals, but many of them looked at different ways to take that wonderful nursing assessment, planning, implementation, evaluation, that rubric we use, and apply it in different settings using their nursing intelligence and intuition.
Exactly. One of the things that you inspire me to think about is there's in the schools today, in the colleges today, there's a lot of young people who want to get environment sustainability. They really want to protect the environment. They're looking for that kind of growth and knowledge base. And I just realized that it would be important for nurses, as hopefully the future changes and we really take these climate change and toxins and things in our environment seriously, that we would be employed by corporations that are really looking at how their production and their products impact on the environment, and nurses would be in these roles to work with the people who are developing these products in the future to make sure they don't harm the public. Mm-hmm. And that would be a great role to evolve into.
Yeah, that might be. I guess that I see more often, I see us as really needing to be the counterbalance.
Exactly.
For what the corporations are doing. I love your optimism about seeing the B Corps, evolving over time. These are special corporations who have made a commitment to the environment, to occupational health, to people.
Right.
The majority of corporations are not yet B Corps, but I love your enthusiasm there.
Well, the future is going to belong to the young people at one of these days.
Yes.
And they are going to be living with the real impact of climate change. And they're going to be living with the impact that plastic is polluting the entire world's oceans. And we may be gone, but they're going to be living, and I don't think they're going to be happy about it. And I think at some point the corporations, this is just me, we need to create corporations that are environmentally friendly, that are not polluting the world. At some point, the world gets polluted and you just want to scream, stop, stop. We don't want this anymore. We don't want your products anymore. You know, make something that works for us to buy in the grocery store. You know, when you go to the grocery store, one of the things I decided is I didn't want to buy plastic anymore. It's so hard.
Right.
Everything. You're like, okay, now how am I going to pull this off? You know, and it's like the world isn't cooperating. You know, everywhere you go, it's like, oh, I've got another plastic bag. And I have on my garbage can landfill. So I take things that I know I'm putting it in the landfill. And it's upsetting.
So here we go. How did we make changes there? In California, you can't have plastic bags. I go to New York, which is where my family are.
Yeah.
You know, it goes through the register, and like every 3 items, they put in a plastic bag. I'm like, it drives me crazy because I actually come with my little Chico bags.
Yeah.
Because in California, that's what we do because
Yes.
they legislated it. Because we went to the State House and said, the grocery stores are not going to voluntarily get rid of plastics. We are going to have to make them do that. And so that brings us back full circle. We must understand how to join with environmentalists and communities of color who are disproportionately impacted by environmental degradation. And we need to go to the state houses and say, this isn't working for us. It's not working for the environment. And this is how we're going to make it better. I don't think we can depend on corporations making the better decisions. I think we have to nudge them.
Yes.
And the way to nudge them actually is through policy.
Exactly.
So those are the skills that I see us increasing and also getting excited about. It's very empowering to walk the hall of a state capitol and realize that you've just spoken to people who can make change and that you've influenced that change.
Definitely.
Yeah, that's designing the future.
That's designing the future. That's fantastic. So let me ask you, one of the things I want to talk, I've just inspired me since I'm talking to you, is how would we create roles for nurses to walk into that would be paid, funded to do this work in the world? Because right now as nurses, we're employed at universities, we're employed at hospitals, we're employed at clinical settings. But I'm thinking, wow, it would be so phenomenal to have be able to do this for a living, that you would work. So what are some ways you think that might happen?
Sure. So, well, one of the ways that I described is moving up within healthcare corporations, moving a little bit away from the bedside. So Beth Schenk, who is a nurse, is now the director of Providence Healthcare System. I think they've got 100+ hospitals because they merged with Catholic West. And she's in charge of sustainability, purchasing decisions, policy decisions for a healthcare system.
Wow.
Which means sometimes going to state houses around regulations. And she's a fly fisher woman. She's an amazing, amazing environmentalist, nurse, leader who's making change. Katie Huffling, who's the executive director for the Alliance of Nurses for Healthy Environments, testifies to Congress regularly, talks at regulatory hearings, and she has brought on board as employees other nurses. Sometimes environmentalist groups have hired nurses. There's a wonderful, excuse me one sec. Sorry. There's another wonderful organization I would like people to know about called Healthcare Without Harm. And it's a national organization. It has an international component called Green and Global Healthy Hospitals. And they work with hospitals to help make them more environmentally sustainable. And there are nurses working with them. So you talk about plastic going in your own trash. Well, many nurses were very aggravated about how much plastic they were actually throwing out in a red bag, which doesn't even belong in a red bag. And so Julie Moyles is another nurse leader working for Healthcare Without Harm. She's been working with hospitals all over the country, as well as policymakers around plastics in particular.
Really?
To figure out how we can push policies that are going to increase the numbers of items that are multiple use versus single use plastic devices.
Right.
And so I'm old. I think you're a slightly younger vintage, but I don't know. But when I went to nursing school, we had stainless steel bedpans, stainless steel emesis basins, stainless steel water containers.
Yes. Oh, yes. I remember this now.
And now all of those are plastic. Why? Well, the plastic industry decided that that is somehow healthier and safer for me. No, you can reuse, you can completely sanitize those and use it for the next patient. And so we need to rethink plastics in hospitals. When you think about, I mean, Martha Stewart is very creative, but what can she actually do with a urinal when you send it home with a patient, right? I mean, not much, right?
Right,
but
right.
We either toss it or we send it home with a patient. It's ridiculous. And we never reuse any of those plastic items with another patient. So what happened to stainless steel? And so what we've discovered is the return on investment is just like a year. So invest in multiple use devices. And that's not just on those kind of durable goods, but other things. So we're huge purchasers of plastic. You're an individual purchaser, but healthcare is big. So how do nurses compel their purchasing departments? And so Healthcare Without Harm is an organization that supports these efforts, provides the return on investment analysis, all of those kinds of things to make the arguments.
That's fantastic. You know what? Is there a possibility to mentor with some of the leaders that are in the field that are creating this? I mean, does your program have fellowships? And does it have ways in which you can mentor the people who are these are the leaders of the future? And I would love to find out more about it so I can be effective. And I know the young nurses of the future that are here, they want to know about it, but we need to learn from our mentors and our leaders. So how can some of the people who are on this call figure out a way that they can get the skill set they need and experience they need, and even do fellowships or mentorships or whatever with some of the people who are doing this work in nursing?
So thank you for asking that question. Right now, there are 2 fellowships that I'm aware of, or scholar programs. The first is the Alliance of Nurses for Healthy Environments received a generous grant from the Kresge Foundation. Okay. And we have 30 Kresge fellows around the country. And we will probably, we hope, get another grant from them so that we can continue with this. And those fellows are specifically working in what are called environmental justice communities. Right. Are communities that are often people of color or poor. And so they are looking at what are the disproportionate ways that they are impacted because that by the addition of environmental exposures. They probably have substandard housing, substandard diet, substandard education. And then you add on top of that a little extra lead in their water, a little extra other chemicals, because they live under the breathing zone of toxic emissions from smokestacks, et cetera. So those Kresge fellows spend a year and a half getting additional education via webinars, in-person meetings. They also each are mentored. So I have 3 fellows that I mentor. Wow. And then we've got 10 other mentors around the country that mentor these fellows. So that's one. The Jonas Nursing Center, which is supported by the Jonas Philanthropies in New York. Right. The Jonas Center is now located at Columbia University. And next year, they will be announcing a scholarship for doctoral students, specifically for those who are interested in studying an environmental and health issue.
Right.
So that's a substantial scholarship that they're providing to help move that forward. But you're on to something, because the Alliance of Nurses for Healthy Environments is very interested in supporting more of these kinds of fellowships. We are interested in also doing some policy fellowships. And so we're in discussions right now with a large international foundation for doing something like that with the World Health Organization and Sigma Theta Tau International. So stay tuned, because we may something.
Because I would love, I've been an environmentalist, and one of the things I realized when I've been very involved with preserving lands and raising money to protect the environment, protect ecosystems, protect wildlife sanctuaries. And I realized, this is actually a role I feel that I have as being a nurse. This is something that I feel like, I may not be taking care of patients at the bedside anymore, but my role is to take care of environments, and what can I do in these environments? And also, how do I work in a pro-environment community and sort of educate people, elevate their education of, it's not just protecting the environment. We are protecting human health. This is what we have to do. We have to re-language, I think. And that's why I think these mentor programs would be so powerful, because the great thing about nursing is you can have many careers in nursing. You can be
Amen.
I mean, it's great. I started out as an intensive care nurse, and then I went and got my, clinical nurse specialist, and then primary care, and then faculty. And, you have this evolution in your career that's so exciting. And I think being going out and being a nurse and being an advocate for the environment is the next calling.
So a couple of things. I do want to tell you about a couple of programs that Annie is sponsoring right now.
Okay, good.
But a couple of ways of thinking about that, what you just said, is you can take your resources and help with the land trust and help with that.
Right.
You could take part of your resources to train folks,
yes,
leaders in land trust, so they can go forth and develop resources, and you have this multiplier effect. So by thinking about how would you take some of your resources and support 3 nurse leaders to learn more about the importance of protecting land. So we work with farmers and ranchers around sustainable and regenerative agriculture. We know that there are ways in which we can sequester carbon, for instance, versus the very extractive way that we often do agriculture. So we're working directly with them, once again, often taking us to the state houses, because it's often the policies that are going to, or the budget for programs on this, incentivizing good crops and good agriculture versus bad crops, because it means farm worker exposures, it means pollution, it means all of these things that impact. So we have 2 different things that I wanted to tell you about that we're involved in. When you talk about land conservation, it made me think of the first. So we're involved, ANHI, the Alliance of Nurses for Healthy Environments. We often just call it ANHI. We're involved in an international consortium called 50 by 40. And the 50 is reducing meat consumption by 50% by 2040. So this is about, over the next 20 years, how we can help move people to more healthy, sustainable, plant-based diets.
Yes.
Not making everybody vegetarians, just moving us more towards plant-based diets, away from such meat-intensive diet. And there are a variety of reasons. There are 3 main reasons that people come into this. 1, plant-based diets are more healthy for us.
Right.
Good science on that, good evidence. We're evidence-based, right?
Yes.
The other is some people come at it from an ethical perspective of wanting to eat less meat simply because
Right.
how you derive meat, right?
Right.
The third is climate change. We know that the meat production and dairy production produces a lot of methane. That is a naturally occurring gas that comes out of bovine.
Right.
The other thing that's happening as the global south tries to adopt our diets, which we know are not very good for us,
Right.
they have been tearing down forests in
know.
South America in order to make them into pasture lands. And so what we're working with lots of NGOs in the global south to shift that. And so 50 by 40 is one of the coalitions that we as nurses are working in, and we bring that nursing voice. Why is that important? And so in that context, we bring the science about plant-based diets and so forth. The other thing, which is a new thing that we're starting, several years back, Paul Hawkins, who is, he's been sort of a soothsayer for many years.
Right.
He helped to fund a process. You know, he recognized climate change, the tsunami that climate change is going to be. And he said, what do we know and can we know about reducing greenhouse gases? What will make a change? Because we know this, because we have some numbers.
Right.
And so he wrote a book, he and a whole group of scientists and engineers and others called Drawdown. And this Drawdown gave 100 things that could make a difference, including better educating girls in the global south. That ultimately we know shifts things more positively and away from extraction and you know, these cook stoves that we know are very unhealthy, et cetera. But also there are numbers of other things. So a group of nurses inspired by Teddy Potter and Katie Huffling, we came together to look at Drawdown and say, let's choose 5 things that we think nurses could do of Drawdown and create a project for them that they could pick or choose one of these, learn a little bit more about that, and move forward. So that's about to launch in a month or 2. You know, COVID kind of got us a little off schedule.
Yeah.
Everybody else. And so stay tuned for the Nurses Drawdown website. And so plant-based diet's one of the things.
Right.
Planting trees is another, and feeds right into your interest in restoring and repairing. It's the right tree for the right place. So making sure that nurses aren't planting a palm tree in Montana, you know, making sure that we got the right trees in the right place.
Exactly.
And we're also looking at how do we design our communities for active transport, so more walkable, bikeable communities.
Right.
Reducing energy, so really looking at reducing energy. And I'm thinking that I'm leaving a really important one. Oh, and reproductive health. And especially in the global south, really helping women have the choice and the wherewithal to have less children when they want less children. So this is nursing. This is nursing, like interpreting this and saying we can bring it forth in a way that nurses can dish it up and make it delicious.
I am telling you, this has been fantastic. I love it. I'm passionate about this. This is one of my great passions. So I'm so excited that you're speaking to it, because I am so passionate about environmental health and trees and, you know, saving the environment, a plant-based diet. You know, what do we have to do to move the future forward? And I am so excited that nursing and my colleagues and you are so involved in this. I appreciate this work so much, and I'm going to get involved. I'm going to join the alliance. It's Annie, right? Annie? Yeah. And I'm going to find out more about it. I am totally excited about it. And I hope I can reach as many nurses as possible to give them this information. Because I think personally, I think there are I have young, my children and I have a youngest who's 20 and he's so into protecting the environment. It's just part of their consciousness now. Of, like, we have to not litter, and they just feel it. And I think nurses who are going into nursing to realize there's a possibility of us being able to make a difference by being nurses.
That's right.
And doing the work that you're sharing with us. This is definitely the future.
Good. I'm glad to hear that. We have a lot of futures as nurses. This is the one that I'm most passionate about.
Yes.
And it's so interesting what I hear from my DNP students. First time they've ever taken an environmental health course, and they now have to take it. It's required. Not very many places have it. Right. And about midway through the course, they say, why didn't we learn this somewhere else in nursing? This is so important.
So important. So important. Well, thank you for being a pioneer and making this change. It's like a turning point. And I really appreciate the work that you're doing and the leadership and the vision that you have. Conscious visionary nursing. That's who you are.
Well,
thank you so much. Thank you so much. I'll be in touch with you for sure.
Okay, I look forward to it.
Okay, great. Take care. Bye-bye.